great. I got it. Doctor, about the cases that the experience, I don't know, the study of the cases that you've shared on your Facebook profile, talking about the 16 patients who have several clinical symptoms, but they have the same X-rays. So based on your experience, do you think that X-rays are enough for making diagnosis?
So the COVID-19 do unique findings in chest X-rays, and we are hugely dependent on the X-rays at the moment. I mean, it's not 100% sensitive, so we can see some changes in other bacterial infections, but I mean, it makes us make a decision regarding this patient and just make an assumption about the initial diagnosis. So, yeah, X-ray can tell us a lot about a patient. Now we can see typical findings in all the corona patients. So now, over the last few months, we have been seeing patients with different presentations. So some of them come with only fever for a couple of days, and some of them come with just dry cough, and some of them come even with sore throat and runny nose, and like the severely ill one come with shortness of breath. And we found the same findings on the chest X-ray. So most of this patient, actually all of these patients, turned out to be positive by the swab test, the nose and throat swab test. So that means that X-ray is very important in diagnosing COVID-19. CT is more and more accurate and sensitive in discovering the shadowing and opacities that can be missed on the chest X-ray. So I think, yes, it's more sensitive than only by symptoms and examination. So, but it's not as sensitive as the swab test. People still rely on the swab test now, although it has only 75% sensitivity. But I mean, you can actually see the virus, because sometimes, especially in people with chronic obstructive pulmonary disease or in patients with chronic pulmonary fibrosis, it will be hard to differentiate between if it is chronic changes due to their chronic illnesses or is this acute changes due to the coronavirus. In this group of patients, it's difficult to see the changes on the X-ray. I mean, it's difficult to assess them if they are COVID-19 or not, and in that case you have to do the swab test. But in most of other patients, yes, but just by looking at the chest X-ray, you can be pretty sure when you say, yeah, this is most likely a COVID-19 case. So the changes you see in the X-ray is very important, and they tend to be like universal now. As I told you, it's a unique findings. Whether it's a young or old patient, you see the same findings. So you see bilateral on both lungs. You see bibasal, most likely in the lower lobes, or sometimes extensive in all lung lobes. And then you see it as opacities, ground glass opacities, and you didn't see subpleural sparing, which is very important. So the pleura and the shadowing is actually connected together. Yeah, there is no space of air between the shadowing and the pleura. So we tend to find these findings in most of the patients who turn it out to be corona patients. And this is very important and very different from the normal changes in the X-ray we see in bacterial infection, for example. So if we have lobar pneumonia, bacterial pneumonia, you will usually see a focus of consolidation in just one loop, in just one side, so it will be unilateral. It can be in any zone, I mean any lobe, upper, middle, or lower lobe, and it will be focal consolidation or not bilateral, and you will find an A around the opacities from each side, which is different to the findings we see in the COVID-19. So now the first thing we do in A&E is to do chest X-ray for all patients, and this is one of the most important factors, not only the factor because you have the symptoms, and then you have your examination findings, and then you have the X-ray, and then you have the blood tests, full blood count, and the UNEs and the CRP, and then you will have your examination findings, as I told you. So when you take all of this together, you will be 100% sure what you are dealing with.